Why we kind of established this meeting is really the employees wanted to get to know the board members. They've seen the board members, they've heard the board members, that they really don't know the board members and what their role is and what they do. And we kind of opened it up for the public to come along as well. I think it's very important that everybody, whether it's public, whether it's employees or professional people or anybody else, to really know what their role is, but how many hours they put in a week as board members. A lot of employees, actually last week when I had these town hall meetings, thought all the board members got paid. They got a paid salary every month. I said, oh no, they do not get paid. And they put in a lot of hours every week, and they have a lot of responsibilities. And that's been the case, been in administration for 43 years. And they put their heart and soul in it. I've been, involved with a lot of boards, but I can honestly say this is probably one of the best boards I've been involved with. Is there conflict? There is conflict. Is everybody a yes person? No, there isn't on this board. I can tell you for a fact, they're not. They work together hard to get where we want to be for not only the community, but for the organization, but for what I think that every person, every patient out there deserves, and that's quality health care and more services. Why should a patient out there that has heart problems drive all the way to Rapid City to, have a stress test or, get an ablation or get this? Why should somebody go to an ENT in Rapid City or Spearfish? We can have an ENT every 2 weeks here. I think that's our goal, to get some specialists here and grow this organization so we can be sustainable for the next 20, 30 years. I think that is our goal, and I think that's the board's goal. Because if we don't grow, I can tell you we're not going to be here in a year. If we do not grow right now, because we're already behind, we've got to grow now in order to get where we're going to be here in the next 18 months and be sustainable. It's just a fact.
Yeah, a lot of rural hospitals are closing all around us.
Yeah,
Critical access hospitals.
If you go to Texas, and if you go to Indiana, you go to Florida, you go to your bigger states, it's not uncommon for 5 to 10 to 20 hospitals to close in 2 years because they are not staying up with the times. They're not recruiting specialists to come in, new service lines, infusions, injections, physical therapy, and they don't know really how to recruit physicians to come to their community. And more physicians nowadays that are in your big cities that are treating high traumatized patients, these physicians are tired. They're working 18 to 20 hours a day. So they want to get to small communities where they can take their young family, their boys, their girls fishing, boating, skiing, all of that. They want to, but they haven't had the opportunity because nobody has reached out to them. And that's been my forte in the last 15 years, to go out and work with the universities and physicians that are in residency, say, hey, let me take you and your wife, and if you got kids, let's go out to dinner. Let's talk about what your goals are, where you want to be, what kind of lifestyle you want. And I've been very fortunate that I've been able to recruit, 20 to 30 physicians in the last few years in rural communities. And that's what they want. I mean, they really want that.
You talked a lot about the hospital, but you also have a manor here.
Have a what?
Manor facility?
Yeah, long-term care. And I am so proud of the long-term care facility. I mean, I have never seen I've been in hospitals where we do have long-term care facilities and assisted living facilities. I've not seen such a long-term care facility where not only the employees care, but the kind of care that they get from memory care, long-term care, the activities part of it, and the overall community involvement. I mean, had the privilege of staying there over at Thanksgiving and eating with some family members, but also the residents, and just sitting down with the residents and eating Thanksgiving, and them two ladies that I ate with, how good the food is, you know, how good the staff is, and we get to do this, and you know, they didn't have family members. They had no family members at all because they didn't have any children. And you know, they said, can you come back at Christmas? Or can you come back in 2 weeks and see me? You know, and I do. I go over there at the long-term care, but they get great care. And I think we're going to see the long-term care facility grow over the next 5 to 10 years. I think we're going to have to add, the way the population is going, I think we're going to have to add, you know, 50 to 75 beds over the next 10 years.
Well, you have the space because the voters voted for the big addition that's not being used.
Yes, what I'm proposing to the board, and if the board moves forward and agrees with it, we will have the space.
Well, you understand, as a voter, I voted for that. I voted to put my money into this hospital, and many people in this community did. And so that's a big concern for us, is that we invested in the community. You said you needed the space, and you're not using it now.
We're not using it, or we're
No,
not
I
utilizing it.
think part of the problem is that,
That one
you know,
wing.
Are you talking about some of the beds that are not being utilized?
Yeah.
The additional wing that the voters.
the wing.
The
The
wing,
wing was, can I clarify this real quick?
yeah.
Before you came, that wing had to be shut down during COVID because we had to bring in travelers
Staffing.
for staff. And then if we're not staffed appropriately, we can't add patients. But I think there are patients in the new wing now.
I guess, yeah, I'd like to
There is.
tour it and
Yeah.
see
Should-
for myself, because that, if you remember, that only passed by about 300
I know.
votes.
Mm.
And this is an aging community. I don't-
Right.
You seem like you know that. So when I hear stories of people at the end stage of their life trying to get into this facility that are being turned away, that is a very, very big concern.
Right,
So
and
how do you, what is your solution to accept these people at the end stage of their life? Instead of telling them, we don't have room, we don't have staff, we can't take your loved one.
well, I think you gotta look at it from a strategic standpoint. So in the past, if it was due to COVID, but right now, if it's due to staffing, then hiring the additional staff. But also, some of the rooms that we are speaking of have HVAC problems, which we are addressing, and the board is addressing. And I will be presenting that to the board at this next board meeting this Thursday on what it's going to take to bring the facility where it needs to be to add those additional rooms or get them rooms operational.
So when Judd Dawson was here, he instituted sign-on bonuses that went clear to housekeeping and kitchen, but it looked to me like all of those have been taken off the sign-on bonuses. Was that at your direction, or?
No, that was not at my direction. The nursing sign-on bonuses are still there.
It's not listed in the ad in your paper.
Well, I am not over the ads in the paper, but I will look into it. I did interview a nurse yesterday, and she did ask about the sign-on bonus, and I told her the sign-on bonus was still in effect, and I just signed off on a nurse for long-term care with a big sign-on bonus.
So Charlotte, we still have a sign on for the CNAs, right?
We do.
Yeah.
Yep, if they're full-time.
But your ad doesn't reflect that?
I don't think so.
Well, we better look at the ad.
No, I don't. I believe that was taken off. That was, one of the concerns too. And I guess the other concern, of course, to people here is the debt, that the hospital is in. That is a concern. And I mean, in the past, I guess, where you've worked in other facilities that are probably owned by major corporations. And
No, most are not. Most are owned. They're funded through operations, and they do get a levy. Some get a $500,000, some get $600,000. And the highest one I've ever worked with was $1.3 million levy. And that was it. All the other was funded through operations of the organization.
So you understand the people of Weston County own this hospital.
the people, yes, they do own the hospital and the long-term care facility.
And I toured this facility when the new wing was, during the open house with a lot of aging people who thought it was so wonderful, there would be a place for them, when they needed it, type of thing. And I just want to stress that this hospital is very important to our aging community.
It is very
And
important.
if you're not able to meet their needs at the end stage of their life or any time during their life, it doesn't sit well.
Right. And we will get there, definitely. It is a strategic plan, and like I said, I've only been here 8 weeks, and we're
Yeah.
still looking to many, many opportunities for improvement to get where we need to be. And like I said, it's not only the long-term care facility, but it's also the home health. It's also the hospital as a whole, because if you don't have all these organizations tied together, you're not going to be sustainable. And if you don't put in new service lines, as I have presented to the board, we're not going to be here in a year. And that's the truth. And we have to move forward with a lot of these new service lines.
Kim, I want to add to that is, the staffing issue is across the whole United States. Everybody is having trouble getting staffing. And, we try to do the best we can between balancing what we can afford and the traveler or the nurses or the CNAs that we bring in to supplement the staff, which costs a fortune. So we try to recruit hard, find people to fill the spaces, which, again, everybody in the entire United States is having an issue with staffing. You read it every day in the Becker News and wherever else. So, it's a constant battle of trying to get enough staff in here. We go to the high schools, we go to the colleges, we go, we try to use every resource that we have to try to get people to come in here and be a permanent staff member versus a traveler that costs you double to triple the money.
Yeah.
Yeah, travelers all.
I get it. It's like a
I know.
catch-22.
It's like with the paper though, if we
Yeah.
don't have our reader support, we're
Right.
not gonna be there either. So that's what I'm trying to stress to you is, you have to be here for this community. You can't just make it, you
Oh,
can't,
absolutely.
you can't say, oh, we can't take it. This was something recent. A gentleman had pancreatic cancer and was at the end stage of his life. He tried to get in and was told no, they couldn't.
Well, there's a waiting list as well, too.
But I'm
Yeah.
saying it's,
And I understand your frustration, I really do. I've got a big heart for long-term care. If I didn't have a big heart for long-term care, I would not be over there walking through the long-term care facility, talking to the residents over there, looking what kind of care they get. I've had family members in long-term care units, or personally have taken care of myself in end-stage life. So I do understand. But coming from a professional standpoint, not only with nurses, but CNAs and physical therapists that work in the long-term care and every other part of healthcare, staffing is an issue across the United States. Do we offer great benefits and great traveling pay for everyone out there that's looking to get paid as a traveler? We do. It's very high. But even as a traveler, you can't always get them because they're going to go, wintertime, they're going to go to Hawaii or Florida because that's where it's warm. In the summertime, they're going to come out to Wyoming and Montana because they want to see Wyoming and Montana, but they may only stay 3 months. And you're going to pay them anywhere from, just hypothetically say, just a certified nursing assistant, $38 an hour, and you might pay a nurse $84 an hour. Or if you're going to go out there, ultrasound tech, which my wife is an ultrasound vascular tech, then you're talking $128 an hour for a traveling ultrasound vascular tech. Which, as before, they used to get paid $32 an hour. So yes, the price is extremely high. Do we have to watch costs? We do, in order to be sustainable with our current employees, but also to be able to be sustainable for the next 10, 20, 30 years for the community and all the patients within Weston County and the surrounding counties. And I get it. Do we have a lot of work to do? We do have a lot of work to do. Is it going to take some time? Hopefully not as long as it has been. And we will get there.
So when someone calls here and you say we can't take your loved one because of staffing, do you feel any obligation to help place them somewhere else?
I do. I do feel that
Someone
obligation,
here-
but nobody has called me on that yet.
But
They have to call you to get
No,
that?
No. Our
no, they can
DON
call,
works with them
they can call Melissa,
over there.
they can call the Director of Patient Care Services,
Social workers over there.
or the social worker to get them in. What I would like to start down the road, I would like to start a hospice wing as well.
One thing I wanted to add as well is that it's flu, COVID, well, mainly flu, norovirus season. So sometimes that wing can't take people because we have an outbreak. So that's another thing you need to think about. But I need to stress that our staff does everything possible that they can within their means to take care of the community.
Because usually they go to swing bed.
You're right. We have another
If there's a-
availability at the
Yeah,
other end of
filling
the
out-
acute
Well, I
side.
think they had to demand that, so, yeah, I,
No, They
You
don't
guys-
have, no,
yeah.
they do not have to demand that. That is up to the provider to be able to swing. If they want to swing that patient over, they can. If they want to swing that patient back, that's up to the provider.
well, I think there's a lot of concerns, that you need to work on, and I guess the other concern is the $3 million debt and why you chose a firm in Texas to handle those finances of the hospital here. Was that solely your decision?
No, so what happened, and I will stress enough, where the $3.2 million, wherever the debt was that was put out there, I had nothing to do with that. What the board decided on when the firm in Texas and did their presentation, the board decided to have them do an assessment. They are not doing the financials. We haven't went that far. So they're doing an assessment of all the financials to see where we're at. We have no idea where our rural health clinic is, and they haven't for 15 years. What type of revenue we're getting, what is going out. We have no budget because there hasn't been no budget. We do not know on a acute care side what our true expenses are and what our revenue is if we're losing or if we are profiting. And they haven't really known true financials for 15 years. So kind of playing it by ear. Have we taken any money out of the money markets? Not since I've been here. Are they working AR days to get the AR days down from 50-something down to 30-something? Yes, because once you get AR days down, you get cash in.
Could you
Have
could you explain that for people who may watch this later? Because I couldn't follow
Yeah,
what
what's
you were
an
doing.
AR?
So
Accounts
that's your
receivable.
days that are in accounts receivable. So you're working with the insurance company, you're working to get all the money in, whether it's Medicare or Medicaid, you're working to get them days down. Back in the olden days, you used to put a chart up, back in the 70s and early 80s. So your days would be 90. So you know that your cash on hand was very, very low. So the quicker you get your money in from your insurance, third-party insurances and Medicare and Medicaid or self-pays, the more cash you have, the more days cash on hand you had, which is really good.
And it's a combination of private insurers,
Right.
Medicaid, Medicare, and self-pay.
So, I mean, the board voted to have this firm do an assessment. There was another firm that has been in here for quite some time, and it was going to take them another 6 months to get some financials. So when the firm out of Texas came in and did their presentation, the board decided to have them do an assessment. And when that assessment is complete, then we'll know how to move forward with every aspect of financials that the board is looking, and they will have whatever they want. If they want to know what the profit and loss is at the rural healthcare clinic, they'll know. If they want to know what physical therapy is bringing in from a revenue standpoint, but what is going out and what's our profit ratio and what's our return on our investment. Same way with the pharmacy and the 340B program. So what is going out, what's coming in, what's our profit, and so on. Because right now, we have nothing to go by and never had for years.
How
Do you
did
have-
you pick Texas?
Well, they did a presentation, and their expertise is critical access hospitals. They're dedicated to the smaller facilities across the country.
So you sent feelers out saying, we want this assessment, or
No,
this
I
is a firm
sent-
you've worked
no,
with before?
I contacted 4 individual groups, and this group was the cheapest by far. Other ones were $300,000. One we've already paid over $100,000 to, and probably would have spent another $100,000 to. This one to do the assessment was $5,000.
And just as experienced. I
And
mean, there was no
just as
experience
experienced.
difference but there was some focus differences where some of the finance companies work with big facilities and big groups, where these guys are all critical access, dedicated. Their presentation, which was actually recorded,
Yeah,
was really terrific. Something that we were really interested in because we as a board, along with the CEO and the rest of the staff in the hospital meaning the whole system, want to get to the bottom line of what's going on here and where we need to go to move forward, what we need to fix, is okay, that kind of stuff, which we don't feel we've had that information for a long time.
So that brings up the Upton clinic that is being considered.
Mhm.
So how will you assess if that's gonna to me, it sounds like it's open to people that can't pay, or have limited access to pay. So how are you gonna determine that will make a profit?
So the Upton Clinic, what I had proposed to the board as a federally qualified healthcare center, which is mostly funded through grants, so underserved people within that area, geographical area. So you would do a pro forma on the people in that area, what can pay, what's your payer mix and everything else. And they will come up, after the pro forma, you will see what the profit's going to be. Right now, it's just classified as a standalone clinic. It's not even a provider base, as it's stated from previous administration, that not only that clinic was going to be provider based, which is the higher reimbursement, but the one across the street was going to be provider based reimbursement, which would have been a higher reimbursement. It's not. Come to find out, after looking and investigating, it's just a standalone clinic. Our payments are capped, and that's it. So we're looking at, okay, what do we need to do to make it a provider-based clinic across the street? And get Upton right now as a provider-based one. From the state, it says we have to invest $1.45 million across the street to bring it up to code. And the Upton clinic, I think, don't quote me, but I think it's close to $400,000. And it would not be in the best interest to put that much money into either clinic, because we're still gonna have an old clinic. So, but we're working in the PAYCO system, where everything goes for Medicare and Medicaid with the Center for Medicare Services. So I was able to get into PAYCOs, and that has not been updated for a long time, because we have 48 providers. It says we do, Weston County Health Services, 48 providers. Well, we know we don't have 48 providers. Former administration in this, there's only one board member listed in PAYCOs. All your board members need to be listed in PAYCOs, and they're not. I'm not listed. The former CEO, Judge, is not listed. There's only a couple of people listed in PAYCOs that can actually go in there and change things. So we're gonna have to go in and put some time aside to clean PAYCOs up, but also see, maybe we can get the provider-based clinics back. Maybe there was an error just in a typo. Maybe some of the paperwork wasn't submitted the way it should have been. And if that's the case, we can get our provider-based clinics back and get the higher reimbursement. But as we move forward, one, from a life safety perspective across the street, even if you do put $1.6 million, $1.5 million into that facility, the problem is, if you've ever been over there, the way the parking lot is laid out, it's a safety hazard. I myself helped two elderly patients get into their vehicles along with their daughter. If that patient would have stood up and got in her wheelchair, she would have rolled down and been out into the highway.
Is there really that much traffic in Upton that would support a larger clinic?
So just being up there and talking with Upton and the way it's really growing, even right now, if we had a full-time provider up there, they would be busy every day. And that's what we hear on a regular basis. If you had a full-time provider up there, we would see more patients up there in Upton.
So right now, someone from Newcastle staffs it,
Right.
provider.
Yep.
How many days a week?
Well, right now, we're up there, it just depends. Some days we're up there 2, some days we're up there 3, depending on if the provider is off down here or calls in sick, then we can't send a provider up there. So some days there may be only one provider up there. It just depends on if a provider calls in sick, or a provider has a day off, or a provider decides to take a vacation day, and we can't send a provider up there. But there probably is going to be a nurse up there, maybe 3 days, 4 days out of the week. But a nurse can only do so much.
Yeah, and I think that if we get the funding for the federally qualified health center, that we'll be able to offer more services there. You know, we'll be able to expand to offer more services than just seeing the physician or the medical provider. There's a little tiny pharmacy there, but we could expand into physical therapy, those kinds of things as well if we have funding. And they're building and building in Upton, so we think that it's feasible.
Yeah, I talked to the CEO from Campbell County, and he agrees. He thinks that FQHC would be great up there, not far from Campbell County. But if you establish a FQHC, you've got to have a dentist, you've got to have social worker, you got to have psych, you got to have all these different providers up there, because you're getting reimbursed from the government. That's where your money's coming from. So that has to be done on a regular basis, and the care is outstanding. And
But I
that-
thought one of the concerns with this facility is that the Medicare and Medicaid reimbursements are lower.
No,
They are, but that's what we're talking about. Maybe you need to explain a little bit more about that.
Now, what was your question again?
That for these people that can't pay, you're saying the government pays, but we already know Medicare and Medicaid reimbursement is lower, and that's why we hear a lot of the facility is in debt.
But it is lower, but if I spoke with the Wyoming Hospital Association president last week or week before last, so the Medicaid is rising, so the reimbursement on Medicaid is going to be higher, but it's people like us, from the CEO, CFO, CNO, and all the people in the organization to fight for higher reimbursement from Medicaid and Medicare. That's why you have your people with the hospital association, or people like myself, writing into the government and supporting an increase, whether it be in Medicare or Medicaid. And then if you look at charity care, we have a lot of charity care. Do we write off millions of dollars a year? We write off several $1 million a year to bad debt where people can't pay. And I think that's good. If we can do it, so be it. But we will try to collect as much as we can, whether it's $1 a week or whether it's $5 a week. I think we have the best interest of every patient in Weston County and the surrounding counties at heart. I really do. Is it going to be hard as we move forward and government cuts Medicaid or Medicare? It's going to be hard. Do we have to work harder? I don't think we have to work harder. I think we have to work smarter. We've got to be smarter than government out there. We've got to find ways to increase the revenue and get the money in, but provide great care. That is our goal, is to provide outstanding quality care to everybody that deserves it, not only in this county, but the surrounding county. They deserve care. That's what care was all about. That's why hospitals were put into existence. That's why long-term care was. That's why hospice was, to provide care for my family, or your family, or the elderly, or the people that are uninsured. That is our goal here at this organization.
So with the staffing issue, one of my suggestions at Judd Dawson's meet and greet was, would you consider that wing that was not being used for assisted living? And he did check into it, but he said because there was no firewall constructed,
Right.
it could not be used for assisted living.
You couldn't use the same staff.
Right, but
Right.
yes, and we are looking into that as well, because I do think and I will present to the board some options for additional land to where I think, and it would be profitable if we looked into assisted living care as well as hospice care. I think it would be in the best interest of not only this organization, but also the residents of Weston County and the surrounding counties, just because of the aging population, and we're all not getting any younger, and we're gonna need facilities like that.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
The aging population, and we're all not getting any younger, and we're gonna need facilities like that.
Sorry, do you have?
I had a question. You were talking, I have a couple of them. Yeah.
And by the way, Judd's not here long longer, so I don't.
I know.
And I don't look at the past, I really don't. I look going towards the future. Some things may come up from the past, like financials and things like that, but that's one thing we've really got to get worked out is the financials. If we
Well, I
don't-
didn't want you to think I was picking on you,
No.
because those are the same
No,
questions.
I understand.
And there's still issues
Right,
that need
and
solved.
you've got to understand, I've only been here for about 9 weeks, so
That's okay.
it takes a little while, so. And I don't have a problem with that, because I'm not going anywhere, unless somebody shoots me and kills me.
I'm sorry.
You talked about the specialty clinics and the specialty docs, and I do utilize them, or did. But Dr. Palmer, endocrinologist that comes here from Rapid City, and he is no longer coming here.
Yes.
He's going to Custer because there's no staff here to assist him.
No.
Or wasn't given staff, is what he said.
Let me correct you, I talked to Dr. Palmer.
Okay.
So that was the rumor that was going around. I don't like to knit rumors when they start. So the problem is the distance between Rapid and here. So I offered him
It's Custer here, I'm sorry.
Custer.
Yeah.
So I offered him one when I heard the rumor, a nurse that we would provide. Two, I offered him a driver. He said, the real truth is, I just don't like the distance. I said, I understand. So I've got some specialists with endocrinologists, with ENTs, we've already got cardiology and orthopedic, and we've got 3 other specialists that want to come here. I can't say where they're from yet. I have talked to the board about it, and we're still gonna look at it, but I think with partnership that I'm looking at, I think we can even add more. Is that going to be a space issue? It may not, but then we just have to open up additional space, because I think it's in the best interest of the organization, but the best interest of the public and the community that we provide those specialists so that everyone like yourself can get the care that they deserve.
So the bottom line is it didn't have anything to do with us.
With the nursing issue.
Yeah.
Okay, well, my question was, what are we doing to keep the ones that we have here? The ones that are coming, are we doing anything special to make sure they stay here?
Well, I mean, I can only offer, because, I mean, they charge their own pro fees. I mean, you know, and I can only offer, okay, do you need extra nurse? We can provide that. Do you need somebody to drive you here? We can provide that. But if a provider, professional, specialist decides, oh, what's too far of a drive for me, I can't do that, then we have to look elsewhere. We gotta be constantly looking out for, okay, you're gonna be retiring in 3 years, Dr. So-and-so, you're our cardiologist, you're coming from, you know, Casper, say. So we need to look out for another cardiologist that's gonna be able to come since you're gonna be retiring. So you gotta be constantly on the move, looking what's gonna be best for the community and the organization. And that's what I'm here for, and that's what the board truly believes in. They really do. It's hard work. It's, anybody says they want to be a CEO or they want to be a CFO, or they want to be a board member. I mean, if I was retired right now and somebody said, why don't you go be a board member? I'd say, are you crazy? I mean, that's just way too much work. That's a lot of time. I mean, that's a lot of time away from your family because all the work you have to do and everything you have to review. I wouldn't do it. I think we have a good board. We have a good mixture of a board. It's a lot of work. It is a lot of work.
Is this the entire board?
No.
We have
No.
Now,
7.
this is who could come.
This is just become.
We have 7. Two work full-time. Ann is away with Alan for political reasons. Alan Slagle is our state representative. So they're at a political something or other in Cheyenne.
Budget session.
Yeah, and Connie couldn't make it. So I just invited everybody to come, and the ones that could come came.
Yeah.
Wednesday, we're having another meeting, and I know that Nick can come, so he'll join us.
Yeah.
So I'm not sure, but there's 7 of us.
So can I just, from my perspective, when I got on the board in 1991, there was $350,000 cash on hand and no line of credit.
Did you say 1991?
2019.
Is that
Sorry.
2019.
Yeah. Anyway,
Well, that's a long time.
it is a long time. It feels like a long time.
Better specify.
But anyway, it was a pretty dire situation. And then COVID hit in 20. So the CEO at the time started getting ARPA money coming in. And what did we end up with? About 12 million, 13 million?
13.
Million in extra funds to pay for the expense of managing the pandemic. Okay. Today we have about 5 million of that left, right?
Right at 6 million.
Okay.
We have in
So we have 6 million in reserve. So that puts us in a pretty good spot. But we're really cautious about expenses and revenue.
Yeah,
We want
we
to
have to.
it's not rocket science. You got to cut expenses if you don't have enough revenue. I mean, it's just like your bank, your checking account. Also, when I started being treasurer, I found out that the business office, at the time the AP department, wasn't doing monthly account reconciliations. She wasn't balancing those accounts all the time. So it would go on for several months. And then they would put it on somebody else's desk. And so somebody else had to take it. So that is a problem that we've had from the get-go. And that is why we don't have the current and accurate information. Because when our audits were done, we had to hurry up and run through that audit thing and force balance basically all the accounting that had to be done in a year. They put it off for 6-7 months.
Well, also, I think our reserve was probably around 3.5 or 4 in the summer. And
Yes.
we're already at 6
Yes,
in that short
from
period of time.
that money. We had 4 after Maureen left. We put 2 in a money market because we didn't want anybody spending that. And we put 2 in a
Bonds.
CD.
We did, and 3 weeks ago, we put additional 300,000
Yeah.
into the money markets. And then we
Yeah.
talked to the bank about increasing
Our-
our rate of
our
return,
rate.
our interest rate on the money that we had in there. So we're getting a good rate of return. But until we get our finances, we get the assessment done and see really where we are and where we're profiting or where we're losing money, and make them adjustments where we need to make them. We don't want to take money out of reserves. I mean, it's just like at home. You don't want to take that money out of reserves. I mean, it's like at Christmas when I tell my wife, don't be spending that $500 a piece on them kids. They don't need it. They got Christmas all year round. And she said, are you crazy? I mean, get with it, Randy. And the girls would say, Dad, and I got to give in. But here, we can't give in. I mean, we've got to watch every penny that we have because we want to continue providing best care, best quality outcomes for our patient. Also, if you look, if we don't move in the right direction in the next few months, We're not gonna be able to give raises, we're not gonna be able to
That's right.
renovate, we're not gonna be able to add on, we're not gonna be able to add specialty clinics. And we will not be here in the next year, we just won't. So, and that's why we have to, and the board has agreed, we've got to move in the direction we need to move in. And that is, we need to expand long-term care, we need additional beds, we need additional staffing, but also in acute care. Do we need to add assisted living? I think we do. Do we need to have a hospice? We do. Do we need to expand our home health? We do. So, and I was talking to, week before last, the CEO over in Campbell County about creating a health career. I called it back in the 80s when I got involved in healthcare exploring scouts. So we would get freshmen from the high school that would be interested in the healthcare field, and we would mentor them for 4 years, if that's what they want to do, is go into healthcare field, whether they want to be a doctor, or if they want to be a nurse, or if they want to be a engineer that worked in the boiler room, that worked on boilers, chillers, or RT, or radiology. So we would meet every week, and they would actually mentor, and they would do like a little residence program. And some of them turned out to be physicians, dentists, nurses, because the hospital gave away several
Scholarships.
yeah, there you go.
Well, you've already, I think, the Mullen girl and Nate Strickland, you already have some of the high schoolers. Is anyone going to the career fair tomorrow?
There is, yes.
Are you going to the
Yeah.
career fair?
Yes, yeah, we have people going to.
And I know
Great.
Monument Health, of course, Dr. Joy kind of heads
Right.
that up, has their own, I don't know, they set up, it's almost like they do this mini surgery things and they have the kids from the high school come in there. I mean, that sounds awesome.
Yeah, and I think that is great. I think career fests are great, but I think in order to move forward, I think you're gonna have to establish something like I was talking about. Get the students in there and actually work, to become part of, you know, what they want, what they really want to become, you know. I've had one of my kids wanted to go into being a orthopedic surgeon, but after she got in there and started mentoring and then started working, she said, this isn't for me. I'm going to be a pediatric nurse practitioner because I want a family. And then, you know, some people in this program I was talking about, they got in it, wanted to be a dentist, and they thought, no, this is not for me, all this two-step, all this gag, and so they went on to be a nurse, you know. So I think once they get to feel what they want to become, it's you know, I think it's our responsibility to get them where they need to be in the healthcare field. I really do, and we can get them there.
Yes, sir.
We were having the ambulance, Campbell County, I think it is. I believe it was at the last city council meeting. It may have been the county, but I think it was the city council. And they were kind of addressing some of the updates going on with them and the problems they're having, staffing problems they're having. It seems like they have more ambulances now available to this area than what they had a year ago. But the staffing issue still was not really there, and they were talking a little bit about possibility of having people that were from the staff here at the hospital being drivers or whatever it was.
Yes.
Could you address some of that and what's going on that
Yes,
way?
and that's a good point, good question. I met with the CEO and some of the people that head up that service from Campbell County. We're looking at ways to where we can get higher reimbursement on the runs throughout the county, but also from a training perspective and educational standpoint, whether we can get them as paramedics or EMT, ACLS, all of that, get them certified in all that. And we're working on that. I've got a meeting with them in a couple of weeks to see what we can do. I've got a call with a couple how do I want to put it? Specialized firms that specialize in reimbursement for just ambulances and if we're gonna be able to put them on our cost report as well, because if we can, that means we get a higher reimbursement, but then on our cost report at the end of the year, we get money back. So we're looking at all avenues on that and be able to increase that service throughout Weston County, but all the other counties as well.
One of the issues they brought up was the lack of people that were signing up to get, for instance, EMT certified.
Right, and that a lot of that has to do with the cost of the course and the time involved, and we can work around that. And I think there's money available out there, and there's grant money available out there as well. So that's what we're discussing, and hopefully we'll have some answers in the next 4 to 6 weeks, because it's very well needed. It's come a long ways, but it's not come full circle. And
What will you guys, do you have any ideas about what you're going to do to get the word out there to the public for people who may be interested in something like that, but maybe they don't even know it exists?
Well, I think that comes from marketing, media, also education. I think, going into the schools and talking to your freshmen or sophomores, your juniors and seniors, do they want to be a paramedic? Because there's good money in being a paramedic. You can make a great living on being a paramedic or an EMT. Whether you get PALS or ACLS. I mean, some paramedics out in the field, they can start central lines. All they got to do is talk to the physician. They're out in the field, and a patient needs a central line started. They're going to start a central line so that patient doesn't die. It's the right training, the right education, and getting the right people in there that want to put forth the effort to become a paramedic or an EMT. And there's grants out there for housing for an EMT station or paramedic station as well.
Walter, let me add that before Randy came, we did have a lot of advertising about EMT class when Angie was here, and the interest was very tiny. So there was advertising, there was class available, there was money available, there was training available, but there wasn't a lot of interest. So we could try it again, for sure.
So
I think you need to, I better not tell you what I think. I'll tell you what. How will you get interest?
Well, I think you got to educate. I think education, what it's all about, it's not just going out and getting somebody out of a wrecked car and putting a Band-Aid on them. I mean, you're actually doing nursing work. You're actually doing this. You're actually, doing a lot of different things that by law you can do once you become certified as a paramedic or as an EMT. I mean, you got to go through the training.
Well, the other part is the time commitment.
Yeah, there's a lot of
that
time,
kind of stuff.
but whether that's paid time as you're learning. I mean, you got to work out a lot of things that has been a negative in the past. Okay, we're going to pay you for your learning, and then you're going to go through the course. You're going to sign up, and
So you talked a lot about trying to get the high school students interested. So are there ways they can become certified while they're still in high school? I mean, do you offer any kind of credits or anything?
so I mean, they would have to go through the state on their requirements, and they may become certified when they're a senior in high school. I don't think they would become a certified EMT or a paramedic in their sophomore year, just because.
CNA.
Excuse me.
CNA certification?
CNA, yeah, CNA. We have CNA certification right now, and
Okay.
actually, it's good.
It's up to
We've had a few
age.
classes.
Yeah, we've had classes.
Yeah.
We've had the high schools come in.
So they have to be 18 or?
Not for CNA.
No.
16.
16.
Yeah, my daughter went through that. Actually, she went through it at 15.
To play the devil's advocate here, then.
Oh, no, I was talking more about what they can do
Yeah.
to be certified before they leave high school, because there are students who don't want to go to college.
Right, and you don't have to go to
course.
college. I mean,
So-
you really don't.
So maybe you highlight that at your career
Right.
day, or you, I
Right.
don't know, reach out to the schools every so often
We
and,
do
Right,
that.
even your whether you're a paramedic, EMT, CNA, or pharmacy technician. You don't have to go to college. You take the courses, you take the certification, and
You pass and you're in.
and that's it.
Yeah, it's good money.
Well-
Walter wants to be devil's advocate.
To be the devil's advocate here, because sometimes it sounds like this to me a little bit when people are reaching out for stuff like this. It's like they're trying to appeal to a person's better nature. What if they don't have one?
Exactly.
How do you get their self-interest involved?
Well, I think that comes from, not only career fairs, but going out to speak with, whether it's the principal of the school corporation, probably the principal of, because that's how I did with the Exploring Scouts. I met with the different principals and the presidents of the school corporations in all the districts. Say, hey, if you think there's interest in moving forward with this program and getting people involved and getting good paying jobs and coming back to, whether it was Texas or Indiana or Florida or, wherever. And they bought into it. But you have to be transparent and you have to do a lot of hard work. But a lot of people are not willing to put in the effort. I put in the effort. That was in my younger days. Might be a little old now, but I can still do it. And we can get the buy-in. And that is what it's going to take. It's going to take hard work, transparent, and sustainability.
So I would like to know, do you have any more questions? Do you want to know anything more about us? Do you,
Yeah,
you said you had several, so I'm double checking.
Well, just listening here, I can't believe we got it for 15 years and nobody was doing a check and balance and stuff and knowing exactly where things were at. That just blows my mind.
It does.
With
Well,
any
mine
type
too.
of an organization, I just can't,
Well,
I can't believe
A
that.
lot of that, this isn't the first time I've seen this. This is not bad compared to what I've seen. But a lot of boards feel that the CFO or the CEO is actually giving them the right financial statements. And what can you say?
We are on a path of truth and honesty and transparency once and for all.
Sounds like that's what needs to be done first and foremost.
But then
For
there
anything else.
wasn't much notice for this meet and greet either.
Well,
This is employee.
There's supposed to be
This was
employees.
employee request,
Yeah.
when I first had my town hall meeting,
And you have no
last
Yeah.
last Thursday, I guess it was. They said, we would like to meet the board. We know the board. We've talked to the board, but we really don't know their role or what they do. I said, okay, why don't we just open it up as a meet and greet? You can ask any questions you want to ask. And they loved the idea, so that's what we did.
And we're gonna do another one Wednesday.
And that's just for employees.
Well, we can it wasn't advertised for just employees. And, if the employees want to come, that's great. But also, if the public wants to come, that's great, because that's why we're here.
Yep.
Yeah, I just saw it on Facebook.
But we also,
And
it's not-
at our meetings every night, every third Thursday,
Anybody can come.
anybody can come to those
Yeah.
and sit in and listen.
You can
And,
even Zoom.
I mean, more the merrier.
And, this is not gonna be the beginning and the end of this. We're just
No.
Randy wants to keep this going on a regular basis.
I think it's very important, and I've always had town hall meetings for all the employees after every board meeting. I don't care if it's on second shift or on first shift. Every employee has the right to come in here, usually have cookies and drinks.
Sorry.
But to come in, ask questions, what are we doing? Are we fixing the HVAC? Did we fix the heat exchanger for the hospital? Yes, we did. It was actually put in Friday. What are we doing for staffing? Or, can we get a backhoe for snow removal? Or whatever questions they want to ask. I'm going to tell them the truth. And they know that.
And so will we.
Yeah.
The thing that I want the public and the employees to really understand and know for sure is that this board is committed 100% to the existence and the success of this facility.
Bar none.
Bar none. so that we have the best facility with the best employees, the best care for the best of the community. And that's how we believe. And we firmly believe that if we don't take care of what we have now with Randy's leadership,
Yeah, you lose.
we can't lose a hospital here
It'll
because
devastate
people will
this town.
die.
Plus,
Yeah,
you know,
devastating.
you've got 220 jobs,
Yeah.
you've got a payroll of close to $20 million. What would that do to the community? And it would devastate. I mean, if you don't have a hospital, you don't have a school system, you don't have anything. I mean, you really don't.
Plus,
Just be,
if you're driving to Custer and you're having a heart attack.
right.
I've been through that
Right.
here,
You know, the 3 million.
and I was so glad you guys were 3 minutes away,
I
believe me.
know it.
Thank you.
Because that was a massive heart attack, and
See,
it was one that
and that's what
would
and
have
that's what
taken
we
me
like
out.
to hear. We want to hear that. Thank God. I'm hoping to get out, hopefully in the next 8 weeks, to the public, how much free care we give away, how many ER visits we see, you know, how many patients we see at the rural health clinic, how many patients we have in the long-term care, how many lab tests we do a year. You would be surprised at how many thousands of lab tests we do. You know, how many patients we see, unbelievable, in just the clinic over here, not alone in physical therapy. I mean, you're talking thousands of visits. You know, I want to get that out, and how, you know, the payroll, how, you know, that money, how it's put back into the community, and reinvest, all of that. I think it's very important, because everybody says, oh, it's just a hospital, and that's it.
Yeah.
But they really don't know how many lives we save a year, how many tests we run a year, how much care we give away free, and what money is put back in the community, because we have 220 employees. They get paid decently, and they spend that. I myself have spent over $20,000 just since I've been here, because I love going to the dollar store. I get my truck worked on locally, you know, and, you know, it's just, I love it here.
I have just 2 more questions that I wanted to ask. One, and it came up earlier, I'm going back to that assessment. This community is used to some entities where they will contract out, you know, for whatever job, some kind of a audit or whatever, like writing up a manual or whatever, and the next thing they know, they're waiting. And I hear this a lot because of the videos I do. And they're going, what's happening with that? What's happening? Why is it taking so long? So could you address that as far as, I know that you probably can't give any firm, but how long will this assessment take, as best you know?
So I'm supposed to, okay, that's a good question. I should know by the end of the week when the assessment will be done. I did contact the firm on, let's see, what is today? Monday.
12th.
I did contact the firm on Friday, asking them to give me a firm date on when the assessment will be done. And then I will let the board know when the assessment will be completed. And once the assessment's completed, the board will vote on, let's do this.
Okay.
Yeah, next steps.
Yeah.
When Judd was here, he had brought up some ideas about, I believe, if I got the information in my head right, about moving the clinic like downstairs and then something happening to that building. Where is the disposition of that? Has it changed? What's going on with that?
So we're looking at with the architect, there were some issues that came up, with not only long-term care with the heating, ventilation, and air conditioning, but also, you know, whether we invest the 4 million, 5 million into our current clinic across the street and update it to where we can operate it as a provider-based clinic, but we're still gonna have an old clinic. So, you know, Judd was throwing
With
around.
parking issues.
And you got the big parking issue
Yeah.
that, you know, if you're in a wheelchair, you're gonna roll out into Highway 16, you're gonna be dead probably. So, you know, Judd threw around, you know, looking at moving the clinic over here, within the hospital. Well, that kind of took that, you know, there was discussion with the architect and, you know, but there was really no firm drawings done or completed. to get to the board. So I met with the architect, and I called another architectural firm out of Denver. So they're supposed to be presenting some of that on, okay, whether we can move the business office downstairs, open up space here, or do we build a new clinic onto the hospital, which is going to be the cheapest.
Sure was the swing voter. She's very powerful. What's your, that you could talk about the chairmanship and everything else. It still comes down to you need 3 votes to win stuff. Do you think Vera enjoys that, or do you think it's just she accepts that's the job and she's taking it on herself to go ahead and be that person?
I think she, from what I gather from watching the meetings, I haven't been to a meeting in person in a long time, but from watching them and listening to it, I think she accepts that role. Obviously, I can't speak for her, but I don't know how much I would enjoy being that person. I think it's a hard job. And I think you're in a hard place, especially when you have to sit between those 2 groups of men every meeting and be that person in the middle, which I think she might be in the middle all of the way. I think she might sit between them too.
Yeah, a lot of fur flies around, Vera. And
so they're supposed to be presenting some of that on, okay, whether we can move the business office downstairs, open up space here, or do we build a new clinic onto the hospital, which is going to be the cheapest. Do we have to bring this building up to code? We're checking. We may have to. Most facilities, if it's been a while, if you move a clinic or you upgrade, just say that fire door, if you upgrade that fire door, you have to bring everything in the facility up to 2024 code. So that would cost maybe hundreds of thousands or even millions. I've been in a facility where it would cost us $5 million to do that. So you got to weigh your options and look at really what the drawing and what your best case scenario is. So would it be better for us to renovate inside here, or from a cost perspective, or build on a new clinic? So that's what we're looking at, and that's where we're at.
Okay.
Can I also say that before Randy came or actually even when he came, the grants that we had for the renovations there became superseded what we were given because to come up to code in 2024 was going to cost us way more than the grants we had available. So Randy has this piece of it. We changed the process to go from, we take it from there to here. Now it's, do we take it from there to here or build new? And then reapply for the grants.
Right.
So that's why it seems like it's taking so long. But, the monies, it's because the monies keep going like this.
Well,
I didn't feel like that was that long ago. It's just I heard it that one meeting and then I hadn't heard anything more.
Yeah, it was not that long ago, but the extra grant money didn't come in because of that piece of information was not submitted.
Right.
So that's when we decided to look at, okay, yeah, you can bring the clinic in here, but are we going to have to bring this building up to 2024 code? And if we do, is it going to cost this amount of money when we can build on a brand new clinic, maybe at a lower cost?
And it's still going to be a 30% match probably for a grant. So
Right.
I mean, we know
It's
we
not
have.
terrible
We know we have.
compared to other things.
no, it isn't, but it is going to be money I have to spend.
I had a couple things, but I didn't know if you did.
One of the hospitals I worked at was a small rural hospital in Alliance, Nebraska. And one of the things we did is there wasn't anything like the Explorers or anything. But we went to the high schools and we started a health club. Actually started in junior age, I guess. A health club. And by the time the kids got old enough to be 16, I'm not sure how they did it or anything, or how HR did it, but they actually hired so many kids during the summer, and we paid them a salary, and we rotated them. Some of them they spent time in maintenance. They went out and mowed the yard and
I was
cleaned
in
up
that
the
same.
grass.
I was in that same program at
And then
15.
they came into the pharmacy and workers, and every department had to have. They were only there for maybe 2-3 weeks, but we had to have set up what they couldn't do, who was going to supervise and stay with them. But we got a fairly good response, and I think they're still doing it. That's been several years ago we started it. But they got a pretty good return on their money for it. They got people back, and at least people that entered into some field. So
Right.
that's work to get the kids in there.
I know the program you're talking about, they had that in Indiana, and it was a health science something, and they got grant money back then for that, and that's when
I don't know.
I went into housekeeping when I was 15 years old. I was a janitor on second shift, and that was part of that program because my grandmother was a nurse, and she talked to the head housekeeper to get me on. I worked second shift, but there was other ones that were going to go into nursing and some into other, and they were in the same program that you're talking about, and it worked out really, really good.
Now, they rotated, they work maintenance, physical
Yep.
therapy, pharmacy,
Right.
through the whole
Yep.
year. And if they came back the next year and there was something they specifically wanted, then they stayed maybe the whole summer in radiology.
Right.
Or
Yeah, the same program, and that same program, if people wanted to go into automotive, they would go and work in a filling station where they repaired cars. And if someone would go into food service, so they would go work in the meat department. That was grant money, and those people, I'm not gonna say what year it was, but anyway, I remember that totally. I remember how that was designed, and I wish they had that today, because that would open the eyes of a lot of kids nowadays, where they would be able to go and work in a meat department or a supermarket or car dealerships that change oil. You know, they even took away a lot of different things in school, accounting in school. They took away different things in school that they don't have, that they did when we were younger, but, you know, we can just move forward.
I don't think we have a club, but we reach out to the high schools frequently. We have Nate, our superstar. He's like amazing. And I think he would be good for marketing for sure.
Yeah.
It's wonderful. But, you know, we work with the kids in both the high schools, and we get kids to come in. It's good.
I think it's a tech world. I think we're competing
Yeah.
against the tech.
Well,
You know, because you show some media, you get so many hits, and so you get more money
Right.
coming. And so that's what we're competing against, taking pictures of cats.
like my kids had to work in college, so I think maybe kids need to, I mean, that's a
Yeah.
job.
Well,
These skills they can.
Yeah, right, and my kids I made them work in college. I mean, I said, I will pay for your college, but you're gonna get up every day. And you know what, I couldn't get them out, when they had days off, I couldn't get them up at 6 o'clock. But when they had to go to work and be at work at 6, my God, they jumped out of bed, fixed their hair, and they was off to work, didn't
Yeah.
complain, and worked 12 hours. And it was like, I can't even get you out of bed on the weekend. But you're gonna go to work, but,
Alex, it was their
Yeah.
day off.
Right.
Yeah, exactly.
We see that.
right.
The
I
help
see it
thing
too.
all over. I mean, waitresses and
Right.
everybody's needing
I think
help.
it has a lot to do with education and how you work with the kids and really what they want to be. But if you're very positive and you have a very positive approach, and you can actually have them come into the office, maybe they want to be a CEO, come in and work or mentor with the CEO for a month, and find out what it's all about, or the CFO, or the director of nursing, or a nurse, or an aide. And I think you have to be transparent, but you have to be really open for the good and the bad part of it.
So, back to the assessment that you're having done, is that gonna be available to the public to see? the
I
financial
think
assessment?
it's up to the board, and I wouldn't know why it wouldn't be available to the public, because there's
It'll
not
be an
gonna
open
be,
meeting.
it'll be in an open meeting, and, it'll be about financials, whether it's bad debt, or how much, how much you really are profiting, or if you're not profiting, or if you're overstaffed, or, are you engaged, or what you really need to add. I mean, there's gonna be a whole list when they do the assessment.
I
So-
think,
Oh, go ahead.
well, I just want to clarify this too, and I think it'll make you feel better. The assessment, like, they're not gonna come in and fix stuff. They're
No.
gonna come in
Yeah.
and train our staff, educate them on how to fix whatever our problems are.
Right.
So that's why we kind of really like that idea.
Mhm.
Just do the assessment, but it's not
Tell
like.
us what we're doing wrong to
Right.
fix it, so we can fix it.
Yeah.
So,
And if the board decides, okay, this is a firm that we want to work with for the next year or 2 years, to mentor the staff, but also provide true, clear financials every month at the board meeting. Instead of hiring a CFO right now, they have that obligation. That's up to the board. Are hospitals doing that? Most of the critical hospitals across the nation are hiring remote CFOs for small hospitals. One, it's cost effective. Two, the turnaround for CFOs and CEOs is 1.18 years. That's all they say. Then they're on the bigger paying jobs in a bigger state, bigger hospital. That is why most hospitals are going with remote CFOs, because they can't keep them. And it's a lot, from a conservative standpoint, it's a lot cheaper.
But
And
we
you get the
all,
same thing.
I'm so sorry.
No.
But we also have a keen awareness of community, community, community. We look community first and then spread out. And if, you know, sometimes the community doesn't have what we need, then we need to move on. But because the firm that we've worked with for several years, they're from Rapid.
Yeah.
You know what I mean? So I don't think Texas matters. I think that the quality of the firm matters.
So back to the manor used to always kind of carry the hospital.
Yeah.
Well,
And-
you,
but that's when it was full and you needed more room and.
well,
In our
yeah.
our fees are based on cost reporting. By the time you factor in all that, Maureen used to say that it doesn't make that much money. And you would think that's crazy, because I just think
Yeah,
that's
I
crazy.
mean, if you would look
It's
at the
$9,000
manor
a month for
compared,
self-pay.
I mean, it all equals out. I mean, the manor, and, you know, swinging those patients over to acute care, lab work, the medications.
Yeah.
So you gotta really look at, and we'll know here in the next few months
That's another
on
thing.
really what the manor is profiting, what the clinic is, and the clinic right now, when I pulled some numbers, looks like we are making money at the clinic, which you usually don't make money at a clinic if it's not provider-based. And then we'll know what we're making at the hospital from a profit standpoint. We'll know what we're making at home health from a profit standpoint. So we'll know here in the next few months where we're making money, where we're losing money, where we need to adjust or make adjustments. Or, you know, these service lines are going to take care of just about, new service lines are going to take care of about everything.
So when you give those statistics of how many people are at the manor, how many rooms are at the manor, I think you should also give how many are available, how many rooms are available. Is it, I thought it was 59?
53. So
I think it's 58.
we're licensed,
It's
I think,
58.
for 50.
And you only have currently about 30.
40 some.
47.
I
And
don't look at the numbers this week. Last week,
Yeah.
last month, we had 6 deaths, I think, so our
Yeah.
numbers dropped fast. But they've been increasing them through the month.
So in a scenario, I call up and I say, you know, my father is at the end of his life. He has, let's just say, stage 4 pancreatic cancer. He's in severe pain. You know, can we get him into your facility? Tell me what the process is. They talk to one person and she says, no, we have no staff and no room, and that's it.
No, that's a very difficult question though, because are they coming through the ER? Are they gonna stay in the swing bed on this side? Or are they looking to come in this way?
Or do
He's
they-
in severe pain.
And
He's at
who are
the end
they
of his
talking
life.
to? Yeah, exactly.
He's
So,
in
and
hospice.
you-
Or
you know,
if they
I mean,
need skilled care.
Yeah.
Right, if they need
Right.
skilled
I-
care, they
yeah.
can be admitted.
or home health,
Right.
you know, I mean.
But they were told no.
Just
Wow.
This person called back and said, look, I know you just had 6 people pass away, and
then
put some
that's when
pressure.
then that's when you should go to upper level management, whether it's the chief nursing officer or the CEO, and say, hey, I just called, and the nurse said they can't get my father and my mother into the ER, or they are saying you're full when I know you're not, just because I just walked through, or the manor is full. You know,
For
and then
the-
I would walk down and say, hey, what's the problem?
For the
So,
people who will
what
watch,
about having a team that
We
assesses
have a
when,
quality person that should be called if that ever happens.
okay, for the people that will watch this, who's this upper level management? Who is this quality person you're talking about?
Yeah, Kim
That's-
Sharp is our quality compliance officer,
Right.
director. So anything that's urgent like that, if someone feels like something's not right, they should call her right away.
Would you give me contact, and I will put that in a title form on this video,
Sure.
okay?
Yeah, I mean, it's in every patient room. But,
Okay. But the
Yeah.
person, like she says, is calling in,
Right.
my
I mean,
grandfather's in
if-
pain,
You know,
whatever.
it's like my dad when he was into life. So I said, okay, I called long-term care, I called hospice, I couldn't get no response. Well, I'm smart enough, okay, we're going to ER, Dad. So, you know, they have to treat him in ER as a mental violation or not. So if they think he needs to be admitted, they're going to admit it. And they'll find a bed for him. If it's not at that facility, they'll find another bed at another facility. And that's what I did, you know.
And they would never drop a they shouldn't. It's not correct to say, no, you can't come and hang up. They
Well, I
should
don't
be
know,
helping.
I'm wondering what's your, if you,
Right.
what the
Yeah.
protocol
Well,
is
there's a
here.
lot of
There's
variables.
a lot of little
Yeah.
variables and
Right, I mean,
it's
and
hard-
they
it's
may,
hard-
they may
It should
call
start at
long-term
the
care.
provider, really. The provider should be calling to say, you know, I have a patient that's in this condition and this is what I need for them to do. And if they're looking to go, if somebody called the Manor and they would speak to the director of nursing there
Well, they were told in Rapid that,
in Rapid.
you know, like, Newcastle doesn't always take these patients, where do you want us to try to place?
Well, that's
So they
rapid
didn't get it
story.
from the horse's mouth, they got it from somebody else?
No, they called
Oh,
here too,
okay.
they said
I just
they
want to be
wanted to
clear.
take their loved one home, they would figure it out, they wanted the loved one to be here. So then it fell on them, because they got bad news.
It should have been
Well,
the
again,
provider and
it-
Rapid calling the provider.
Yeah, see, we
Again,
can't,
it's
we can't
their
give you
source,
any
you know.
information because we
We
don't
don't
have
know.
all the details.
Yeah,
You
it's
know, it's
hard
hard
to
to
say.
know.
Hey.
Well, I'm just saying this, you know, you're willing to work with providers, but then you don't, it seems like it's a little tougher if you're on your own trying to
No,
find a
it
place
shouldn't
for
be.
your loved one, but you'd like to be at home when they pass away.
It shouldn't be that hard
Okay,
at all.
okay.
And besides, were they admitted in Rapid? Were
No, they
were they
didn't.
a patient in Rapid?
Yeah.
Yeah, so that's transferring period. Yeah, that's a whole process. So it's,
I'm just saying though.
I know,
This is, you want to believe this is your hospital, and you want people to work with you, whether it's individually or a provider. I mean,
absolutely. And there shouldn't be a no, we can't take you, see you later kind of response. It should be how, you know, maybe we can't take you for whatever reason, but let me see where they can go or where they should go or what kind of help you should get. I mean, it
Generally,
shouldn't
they
just
do
be a
that.
no and hang up kind of
Yeah, I
answer.
think generally they do try to do that.
Yeah,
They try
absolutely.
well, I do know when Judd was here, because I know of another family that was having issues placing their loved one to go from assisted living to more care, say the Manor. And the director of nursing just said, well, you know, we don't have the staff to take that person. And so I looked at Judd at that point and I said, look, you know, and I even looked at the director of nursing and I said, look, I know you don't want her, you don't have the staff, but don't you have any connections to place this person somewhere? And Judd looked at me and he said, well, yes, I do. And he texted someone. And anyways, they had to have some kind of an evaluation.
They do
through
a
a
whole
home health thing.
evaluation.
And by the
Right.
time that
An
happened, the
assessment.
person had passed away. But they worked on it most of the day. But I had to put pressure.
When you call up to Gillette to get somebody into long-term care, because I worked in home health, so they would take several days before you could even get them in, because they had to do this assessment. You had to have a doctor had to do the review, and so it was quite a process.
It
I
is.
know, but
It
those
is.
are two families that I personally know. I'm just saying, you have a lot of work to do here.
I know.
I know for our community, I'd appreciate that, and thank the board members for all you do and serving our community.
I mean, if people would realize the amount of work that goes into just one day and the complaints, but then if you look at the positive that comes out from the patient care perspective, it's really good, and it's all worth it. Do we have a lot of work to do? We know we have a lot of work to do. Are we gonna get there? We will get there.
I think communication, just from what you
It's an
just
issue.
told us, is
Right.
like huge.
But in the meantime, you know, I
Not a
have no
positive story
problem
about,
trying, without any details, just in general, like a generalization, documenting, finding out exactly what the steps are, what the process would be to give it to the public at a meeting.
Well,
Because I think that's what you need to know.
Yeah, and that's,
consumer relations, public relations, and that is where it's all at.
Right.
Even if they don't get what they wanted, being nice, pleasant, trying to help, forwarding
Amen.
to somebody else will go much, much further than it saying, nope.
You're absolutely
Well-
right. And we don't know if that happened, but we need to know what the
Right.
process
Right.
is. We need to be able to say, you know, circumstances beyond our control, maybe we can't take your loved one, but we have these resources for you to, you know, that we can contact,
Right.
check with you, give you more information, give you someplace else, you know, for hope, other than just saying no.
But no, it should never be used.
It shouldn't.
right,
Yeah, I mean, there's
So let's see what
Custer,
we can
there's,
do to
there's
find
all
out.
kinds of places around.
right. I mean, there's always a place to find for mom or dad or grandma or grandpa or whoever. I mean, I don't care if it's over at Gillette, Casper, or how far. I mean, we'll get the patient someplace.
We've sent people to Sheridan, Denver. I mean, like,
well,
it's
and we
not.
have home health too.
And we have
Yeah.
home health, and we also have hospice.
But we are looking at public
Right.
relations, marketing more
Yeah,
now,
we do.
and especially education, because I have planted that seed that we really do need education here from. I don't care if it's the janitor on up to the physicians, to the nurses, we've got to get education back in the organization. And that has been one of the topics at the town hall meetings that I've had. Everybody wants education, from the janitors to the nursing to how they handle trauma patients, the behavior issues. I mean, and we're gonna get it. The board's committed to provide that.
But we also are committed to community education,
Yep,
so that we can have meetings like this and discuss things, people have questions, you know.
You know, sign up people for Medicare and sign up people for Medicaid possibly.
right.
Those kinds of things. That's because our self-pay is so high. It's like, what, 40% of our.
Yeah, it's close to
45%.
50%, but in
So-
education, educating people on Medicaid, on Medicare, Medicare Advantage, and all of that. I mean, we've had a couple, but I think it's our responsibility to get out there on a regular basis and educate people, especially the ones that are just now going to get on Medicare, or people can't pay just because of the money that they're bringing in. That's our responsibility as healthcare providers to say, hey, let me look into this for you. Let me get you on Medicaid. That's what the system was designed for.
Plus, we have those loans that
Right.
we've
Right.
created for people, so.
We have different
Yeah,
systems.
because their
that
self-pay is so high, we're trying to get them some relief to be able to pay for those affordably, you know, so they don't have all that hanging over their head.
Right.
and
Because
we have,
insurance is so high, I mean, the premiums are high, the co-pays are high. I mean, it's just, it's bad, it's bad.
It is.
a lot of people
It really
don't
is.
understand Medicare. And, you know, we know that there's a lot of problems with Medicare Advantage today. And we have people that can talk to people that are having problems to show them there's another way. I mean, Medicare Advantage is open till the end of March. They can change
Right.
before the end of March, because Medicare Advantage talks a good talk, says wonderful things about what they give you, and it's not true. There's a lot of problems. So people that are having problems, hi Seth, come on in.
Hi, Seth.
Hi.
People that are having problems are welcome. We have people that are trained for that. So,
Yeah, I mean, like I said, we have a lot of work to do.
Weather's nice.
But we're getting there, and we will get there. And it's for our patients, and it's for the community, and it's for our employees.
I just need to say one thing though about the operating loss thing. You know, that didn't include the sales tax money and the mill levy money. So when you take that off, it's about $2 million. So it does help it some. We really depend on that mill levy.
well, the other thing is I wanted to add when we were talking about, when you said the matter carries.
It used to.
Yeah, every year our reimbursement rates change.
Mhm.
So you have the same needs and the
Don't
same
get me started
care.
on that.
I won't. And the reimbursement change. So, and the public needs to know that. That's where we're coming from with public education too. Because people make assumptions, even, what they hear in a meeting or they don't, what they read in the paper they don't. They make assumptions from those things. I would prefer if you came to me or any of the board members or Randy and just ask the question.
Yeah.
I'll tell you the truth.
I've got the audit here.
Well,
Right.
you understand that's our job as
Sure.
a newspaper is to report and keep the
Hey,
people
come on,
informed.
is this-
Sure.
Are you
And this
here
is
for a
their
meeting?
hospital and they
Sure.
want
yes.
to know
Oh.
what's going on.
For this meeting?
Absolutely. And we want that to be
No,
clear.
this is done.
You're done, right? I'm
And-
sorry.
No, I
No,
wasn't.
Oh my, well, I saw him and he looked familiar. I'm
Stacy-
sorry. I didn't even pay attention. I apologize.
We're way
And that's
over.
why I
Okay.
want to continue doing, the CEO corner every 2 weeks, not only for your newspaper, but for the Gazette as well, because what we're printing is the truth. I mean, that is coming from us. I mean, whatever we're saying there, it's the God's honest truth.
And we have facts and data supposedly to back it up.
Yeah.
The data we think we have.
Yeah.
And,
And I think it's a good thing, and I think we continue doing these town hall meetings, and if the public wants to come, they're more
you
than
weren't in
welcome.
any, right.
I think it's a good way to get the word out. We're being transparent to all the employees, and I think it's good.
No.
And just for the record, because we hear things at the newsletter about what different entities feel about us as a paper and how we report. And I've been paying attention to a lot of other newspapers as well as ours. And I can tell you that the Newsletter Journal really doesn't do a lot of opinion pieces. We report what people say. We report what activities are done. So you can pretty much be sure if it wasn't said here in a board meeting or some press release or something along those lines, we're not going to go out there and let the public know we think this and this has happened. No, we will report what's said in this room. Things like that.
Right.
We do not try to stretch those
Well,
boundaries.
one thing I will say, so your article, or it was a poll on how do you think management of the hospital, or is it worse or is it better? Well, it said it's worse. Well, you've had the same management for a long time. I just started, so, it's not my fault, so.
That is the perception
Right.
of, and we hear this.
Right.
And that is kind of a public perception,
So,
but it
what
also
would-
takes
what,
time for that perception
what
to
the announcement
change.
should read, what would you change? What would you
Yeah.
like to see change?
Exactly.
If
That
management
would've
is
been more
not doing such
beneficial.
a good job, what would you like to see change? Is it patient care? Or is it snow removal? Or is it the amount of tests that's done in the lab? Or is it the long-term care that we can't get a bed? It's things like that.
When you're looking at the space we have in the paper, most of those poll questions that we're going to have is going to be more along the lines of an A and B answer, just the space we have. However, there is always room that we can make for people, if you wanted to write, this is something that we are curious about, what would your
Right.
opinion be?
think we're gonna be
You
doing
guys are
this
welcome to
survey.
write something like that up and submit it to the paper, and I can
Right.
pretty much let you know, we're going to look at that hard and really consider it
Right.
as far as putting that in. If you guys are wanting to find out from the public what is it you want, you need to also ask those questions of the public. Do it through the newsletter. It'll get out there.
Right.
Yeah, because that question doesn't give us any information.
I understand what you're saying.
And the poll changed. The poll was, first it was one question, and then it switched within 48 hours to a different question, and then the polls come out. Totally
Because it was a yes, no.
I didn't look at.
It
I
was a
didn't.
yes, no, and then it said for better or worse or
Right.
something
Okay.
like that.
Not that it matters,
Yeah.
because,
It was changed. It was
But
submitted
it-
one day and then the next day.
It gives you
Well,
one.
I
It
think-
gives you one piece of information. 84% of the public in this area have that opinion.
of 34
And I understand
But
that
it was
takes
only
time
30-some
to change that.
Right.
But this is also where you could come in and communicate and use the newsletter for this. Write up something, ask the questions you want the community to answer.
Right, right, and that's why I kind of wrote, it had to do with the CFO and then the PO, and that's why I put in sent today about, the CEO corner, that's why I put that in there.
Okay.
So we're
Sound better,
running out of
understand.
time, guys. I'm really
Yeah.
sorry. If you have any other pressing questions, please ask. Otherwise, this room's gonna be.
Yeah, I'd love to
used
talk
for
to you 3 or 4 more hours.
Yeah.
It's been very informative. Thanks for.
Yeah, come to the next one, like I say, I'll be
Wednesday
hosting
will
them
be here
every
at
month,
10.
and they
I
will be
think I have
advertised.
something to do.
Well, you can say,
Yeah,
you are welcome to write, call, anytime. I have nothing that this board won't talk about.
yeah.
Well, thank
Yeah, quit
thank
talking
you.
about me.
Thank you guys, appreciate it, you too. Come
Thanks for
by,
listening.
stop by
How are
anytime.
you?